sad part is all the professionals that you saw, no one had a clue.
No.
No one had any idea that this
I had
could be
never
something.
had an MRI
Yeah.
before. Before
Right.
you, I mean.
Well, we did the
here.
first one.
Mhm.
We
Yes.
started the process.
And I'd never had an MRI.
Where are you from?
I'm from Rock Island, Tennessee.
And can you tell us how we met?
I actually was on the internet looking for anyone who had TMJ problems,
Right.
and I came across YouTube videos of it was you,
Yeah.
and people who were visiting you and talking about how you help them.
And what was your problem? Why were you looking?
I just had severe pain in my jaws.
Can you point to where?
Oh yeah, it was mostly on the left side, but the right side hurt too. It was very painful to eat.
Had you been to other doctors? Did anyone else?
Yes, I had been to several dentists, oral surgeon, and everyone just always wanted me to wear a splint.
A night guard.
A night guard.
Like it's going to fix it. Right. Didn't fix it, did it?
No.
We screened you. We actually looked with an MRI and a CT, and we looked at things. No one had ever done that for you before, had they?
No. Mm-mm.
And as I recall, we wound up seeing things that we knew were beyond our scope. In other words, we couldn't address this with simpler things in general dental world. So I referred you on to a TMJ surgeon, Dr. Piper. Can you
Yes.
tell us what happened there?
We, after my visit with you, right after we got home, like the next week, I called and, talked to him about it and said that I had been to see you like the previous week, and they went ahead and scheduled me an appointment. So I went to see him in April of this year.
Yeah.
And he had an MRI done.
Another one.
Another MRI.
Mm-hmm.
They had done pictures and then also a CT scan. And evidently my problem was more severe than what I thought. And I knew that it was going to be bad from what you had told me.
Yeah.
But it was pretty bad.
The jawbone, the AVN, avascular necrosis, right?
Mm-hmm.
Basically, the bone was dying.
And my discs were displaced.
Like way out.
Mm-hmm.
And inwards, too, if I remember right.
Inward.
And that's what kinked the blood supply,
Yes.
killing the bone.
Yes.
Yeah. Yep. So everyone else was putting you in splints, like that was going to fix
Yes.
a piece of dying bone.
Yes.
Wasn't going to work, was it?
No, it never worked. And I had wore night guards for different night guards for several years.
You got joint surgery, right?
Yes.
Can you tell us about that?
I had my surgery May the 24th.
A fat graft surgery, to be clear.
Yes, it was a bilateral arthroplasty. Yes,
It's been 6 solid months.
Mm-hmm.
How do you feel now? Is your pain still there?
I have very little pain.
So on a scale of 0 to 10, what was your average pain before surgery and what's your average pain after surgery?
Oh, before the surgery, 9 to 10.
Wow.
I mean, it was, I was in so much pain.
Distracting. No, didn't have a life, did you?
No, it was awful. It was not, I felt like I didn't have a good quality of life for a while, so.
What would you say now? 0 to 10?
Oh, 0 to 1.
Almost no big deal. Don't even think about it now.
No.
Wow. Glad you had it done?
I'm so glad that you sent me to Dr. Piper.
Yeah.
It was,
Piper figured it out.
yes.
Do you have any advice for people? Because there's a lot of people out there that have real serious issues with their joints, their TMJs. Any advice?
I mean, I came to you originally to start with.
Yeah.
And like after you doing your exams and stuff.
Neural Occlusion screening.
Yes.
Yep.
After, I was not a candidate, but you sent me to Dr. Piper, and I would recommend anyone who has the pain that I had, please go see Dr. Piper. It is well worth the time and the trip there. He helped me. He has changed my life, and I would recommend anyone to go to see him.
And the sad part is all the professionals that you saw, no one had a clue.
No.
No one had any idea that this.
I
could
had
be
never
something.
had an MRI
Yeah.
before.
Right.
Well,
Well, we did the
here-
first one.
Mhm,
We
yes.
started the process.
And I'd never had an MRI for that. And
Even the surgeons that you'd seen.
No.
one. They didn't even suggest it, did
No.
they? They don't have a clue.
no.
Measured matters.
And I mean, and this is just me. I can't imagine how many other people are out
Millions.
there.
Millions.